This weekend will mark 6 months since the very first COVID-19 case was confirmed here in Toronto, and life started turning upside down. The past 6 months have been very stressful for many, and mental health experts have been watching very carefully for a rise in mental health issues. There's also a very real concern COVID-19 can cause PTSD among survivors.
This is a nightmare, man. I just don't want anyone to get this. Don't get infected. The thing tries to suffocate you to death.
Kevin Mundy says he became ill with COVID-19 in mid-March after attending a funeral in Vancouver. He's still recovering physically and has had to deal with the mental impact as well.
It's deeper than depression and anxiety. It's terror. It's like, that's all I can say it is. It's terror. You're so terrified by this virus trying to kill you that it's disturbing. I sincerely do not wish this on anyone.
One Toronto study found 30% of SARS patients surveyed suffered from PTSD. Dr. David Gratzer, a psychiatrist at CAMH, believes COVID-19 could have the same devastating impact.
We think about people being admitted to hospital and being discharged and assume perhaps for that individual the SARS nightmare is over. But the studies showed that in fact a year or two out, mental health problems persisted. I would assume that to be the case for COVID.
A new study examining 2,000 COVID patients in Canada will not only look at the physical toll the virus can have on patients, but the mental one as well. Dr. Angela Chung is the co-lead.
In Toronto and in Ontario, there are families where multiple people are affected. They live in these multi-generational homes, and so it's not just one person get affected. Like there were multiple patients from one single household, and that can be pretty traumatic.
But it's not just COVID patients feeling the mental health impact of the pandemic. The general population is as well. Mind Beacon, an e-therapy company, has seen a 50% increase in new clients from June to July.
Definitely people are finding this to be a really stressful time. And it's been stressful for people for different reasons, right? Concerns about their own health, concerns about the health of loved ones who they either live with or maybe who live in other countries where things are even worse than they are here. People are facing financial stresses. Isolation has been a really big concern for a lot of people.
Dr. Gratzer says there's concern for those who had mental health issues prior to the pandemic, as well as essential workers who've been at risk on the front lines.
When do you think you'll see the full impact of the mental health toll that this is taking on people?
Well, we spend a lot of time asking that question because, of course, we're trying to think about things from a planning perspective. I think we will have a rise in mental health needs. Exactly how many people and when they will come forward isn't entirely clear. But yes, I think there'll be more need in the coming months.
You've probably heard this advice before, but Dr. Gratzer says the best way to maintain your mental health is stick to a regular routine, get lots of exercise, avoid too much alcohol and marijuana, and get help if you need it.